Assalamu alaikum. I am Dr. Malik Shehr Yar, medical specialist and OET mentor. OET is Occupational English Test. It is a requirement in certain countries to before applying for the job. You have to give evidence of your English language skills. So OET is one of the ways. When you pass OET, you can show that you can communicate in English. Currently, I am evaluating a letter of the candidate, Dr. Mudassir, who lives in Dubai, and he has sent me the case notes which he selected himself, and based on that, he has written a letter of referral. So it was a referral from a GP to a general surgeon for further evaluation of the patient and management plan. So I'm evaluating that, and so I thought that I must share a few of the points with you as well. Whenever you write a letter, just make one thing very clear, that just pick up one format and try that again and again to establish your command on that thing. Like, for example, this guy has opted for a introductory method that he has written Dr. Neil Strognell, general surgeon, etc., and then he has written the date. You can also write the date before, okay? And usually, okay, in both ways it is correct. There is no problem in this. And if I take this date from here to here, means at the start, even then it makes sense. So in that case, you will write the date first, and then Dr. Neil Strugnell, always leave a line, and then Dr. Neil Strugnell, general surgeon, etc. And then you will come to write dear Dr. Strugnell, and then there is one important point. Here there is no comma, okay? So if the comma is not placed here, then you will also not place a comma here after yours sincerely, okay? So this is very important point, that if you are placing a comma at the beginning, then you will also place a comma at the end as well. So then, regarding Mrs. Madonna Smith, when you write in English and you are writing to someone who knows English, and when, especially in the exam, when you are being evaluated for your English language skills, so ideally it should be in a formal way, okay? So the formal way says that, look, I am again saying that this is also the correct method, but the formal way is that you should write it as 30 and then December and then 2025, like, okay, we will place it here, 30 December 2025. This will begin from here, just at the start, okay? So 30 December 2025. So this is the actual, first of all you will write that, and then Dr. Neil Strugnell, general surgeon, etc., and then you will dear Dr. Strugnell, and then I have mentioned to you about the comma, and then regarding Mrs. Madonna Smith. So now look here, after Madonna Smith, after Mrs., no full stop is mentioned here. So if you are not writing a full stop here, then you will follow this pattern in whole of your letter, okay? Not that once you mention Mrs. Madonna Smith without full stop, and then you on other occasion you may mention Mrs. Smith or some other name with the full stop, okay? So these are few of the things that you must remember. Then also I would then there is mention date of birth. I would recommend you to mention date of birth here as it is mentioned, but then in that case try to write the age of the patient in the introductory paragraph, like this one. So there are certain formats available for the introductory paragraph, and you should go with the one that suits you and that you think that that is the correct form, and also that will be easy to reproduce. Okay, like here it has written the thank you for seeing my patient and this and that. So in certain occasions patient might not be yours. Okay, so you may write that I am writing to refer Mrs. Smith, a 70 years old bank manager who has signs and symptoms, not sign and symptom. Okay, signs and symptoms suggestive of Barrett's esophagus, full stop. Your further management and assessment and management would be highly appreciated. ठीक है, your further surgical assessment and management would be highly appreciated. So this is I have shared with you the introduction of the letter and evaluation for the introduction of the letter and few key aspects during the letter writing, and also the introductory paragraph. The introductory paragraph is the reflection of your letter, I would say, and you should write it correctly in correct English grammar, and also it should be clear and crisp. It should convey the objectives very clearly. So this is how I evaluate letters. I almost spend 1 hour in evaluating a single letter, and then also I share the details one-on-one with the candidates. If despite several attempts and the candidate does not improve his letter writing, and then for example, if I convey him certain mistakes in the introductory paragraph and he repetitively goes on to do the same mistakes, then I provide him with the few of the case notes, like 5 to 10 case notes, and I ask him to write letters introductory paragraph for all those case notes. So main focus is to develop the skill in the candidate so that they can attempt any type of letter they would want to. And also it is important that yes, I am providing detailed lectures on OET. I help the guys and share tips and tricks for the listening and reading portion. I share with them the key grammar points. Also I teach them grammar that is relevant to the OET, and also letter evaluations and speaking evaluations are provided.